Greetings to everyone from around the world. I hope everyone is doing well. I'm here today to talk about a new audiological test developed in demand, which hopefully provides a new standard in hearing care, not only for a few years, but also for a very long time in the future. And this test is called Audible Contrast Threshold, or ACT for short. Most of you probably already know me, but for those who don't, I'm Marielle C., International Trainer for Sonic, and I'm so excited to talk more about ACT and how it can make a difference in your clinical practice. The agenda for today is all about ACT. We'll first talk about what exactly is ACT, the benefits for you as an HCP, how do you perform ACT, and what it looks like inside the fitting software with an example of two clients. Of course, we will also talk about the practical aspects that you need to know regarding ACT. The presentation will take around 45 minutes, so without further ado, let's start. Now let's move on and talk about ACT, which provides a new way to measure a person's speech and noise ability. Anyone knows what this is, and I believe 99.9% of you know. So basically, it's an audiogram, and this is a graph showing how well a person can hear. It tells us which sounds are audible, including speech sounds and also daily life sounds from our environments. Basically, after doing pure tone audiometry or PTA for those who are not familiar, which is another word for a hearing test, we are able to know whether one's hearing level is very good or very bad. In fact, did you know that the audiometry test is actually more than 100 years old now, and for good reason? That's because it's the most basic, but most important test we do in the field of audiology. Of course, audiometry is a very important test, but what information do we not get? What is still missing? The audiogram does not tell us how our client will perform in the real world. In the real world, we do not use pure tones or warble tones to communicate. Also, many studies throughout the years have shown that getting a good audiometry or hearing test result does not automatically mean that you can hear speech clearly in noise. In fact, a recent consumer study by Manchaya and others in 2021 have also shown that 86% of hearing aid wearers have difficulty understanding conversations in noisy environment. So this problem remains to be the biggest challenge for HCPs and clients alike, because while the pure tone audiometry diagnoses a person's hearing loss, it cannot diagnose the ability to hear speech in noise. In fact, on the survey that was done before this webinar, here are the answers that we have, which is around 45 to 50 responses. It is shocking, and I'm pleasantly shocked, to know that 82% of you actually do speech audiometry in the clinic. That includes 67 of you who do speech and quiet tests like SRT and WRS. 1% does speech and noise test only, and 14% does both. And only 18% do not do it at all in their clinic. For me, this is really amazing, and I really want to applaud you guys for seeing the importance of doing speech audiometry in your clinic. So keep it up. Let's talk about speech audiometry. And when I say speech audiometry, It's a general term used to describe a collection of tests using speech as a stimulus. You can perform speech audiometry by presenting speech in quiet, for example, SDT or speech detection threshold, SRT or speech reception threshold, and WRS or word recognition score. And you can also do speech audiometry in the presence of noise, for example, HINT or hearing in noise test, or Quick SIN, which stands for Quick Speech in Noise Test. So what information do we get from these tests? First, it gives us plenty of useful information on how well your client can hear and access speech information and not just tones. It helps us to know if our client with hearing loss can still recognize or discriminate speech before fitting them with amplification. Second, it allows us to cross-check or compare with the pure tone audiometry test results. So if the PTA shows a mild hearing loss, but the speech audiometry test show very poor speech understanding, it does not correlate because the client might be giving fake responses. Third, speech audiometry allows us to detect if our client might have other issues like cochlear dead regions, where there is a permanent loss of inner hair cell function and thus cannot benefit from amplification. And it can also detect retrocochlear issues, such as tumors along the auditory pathway. And these cases will suggest that you refer this client for further assessment to a professional. Finally, doing speech audiometry helps you predict how successful the hearing aid amplification for your client and how well they will be able to hear with their new hearing aids. Based on how good or how bad the speech results are, you can then use this information to set realistic expectations during counseling. We've talked about the benefits. Now, what are the limitations of speech audiometry? Time. Time is a big one because depending on the test, you can easily use up to 10 to 30 minutes just for doing speech tests, and that is quite long. Language is another issue, including the availability of validated speech materials, which some clinics might have and some not. There is also a high level of training and technique required for the HCP to do the speech test with confidence, and it's not a simple procedure as doing the pure tone audiometry. It is also more expensive with the elaborate room and speaker setup. And most importantly, it is hard to use the results of the speech test to adjust the hearing aids. So, in a way, it has limited benefits. No wonder speech tests are considered an optional test for a lot of clinics because there are simply too many challenges in making it part of the clinic protocol. When I was still practicing, it was something that I did more thoroughly only when I needed to, but I did not do it for all my clients because it was too time-consuming, despite the many benefits it gave me in terms of client counseling. So, we know the audiogram is vital to program the hearing aid, but it's incomplete and does not give you all the information. We know that speech testing is a great addition, but it has many limitations. So what can give us accurate diagnostic information beyond the audiogram that can address the number one complaint, which is hearing in noise? I would like to present to you a test designed to make speech and noise testing better and easier than ever before. That's ACT. So why ACT and why now? Today, hearing aids are fitted based on audiometric thresholds from 250 Hz to 8,000 Hz. But hearing loss is so much more than the inability to hear soft sounds. Researchers and the hearing aid industry have long looked for diagnostic tests that try to go beyond the audiogram to add to the fitting flow. But mostly they were not successful because the tests they were trying to develop just lacked the relevance and usefulness because they could not predict the important aspects we really wanted to know, like one's ability to hear speech in noise. That is why, together with the audiogram, which measures the quantity or hearing ability, ACT measures the quality of hearing in a real-world situation with lots of sounds all around. So with both combined, you get a complete diagnosis of your client's hearing. So in the sense, the audiogram is used as a foundation for prescribing the appropriate amount of amplification, whereas ACT can serve as a foundation for prescribing the appropriate amount of support in noise. This test is possible thanks to all the research that was done by different groups in DMAT. The Interacoustics Research Unit did up to 7 years of research on ACT. Then we invested more years translating this research into a clinically viable and useful test with a partnership from Interacoustics, Eric Schoem Research Center, and CAR, which is a Center for Applied Audiology Research in DMAT. So together, they have developed ACT into a simple but very powerful test that you can do in as little as 2 minutes. Now let's look a little deeper and explore what ACT is. ACT is an above-threshold, non-language specific test that measures the client's real-world speech and noise ability. Above threshold meaning that the test takes the hearing loss into account to ensure that the correct stimulus level is applied, and non-language specific meaning it can be performed on anyone, regardless of their language background or ability. After doing the ACT test, it will give us a number, which is called the ACT value, which will then be automatically imported to ExpressFit Pro or Oasis Next from NOAA. The ACT value can then be used to prescribe the right amount of help in noise in the software. How to perform ACT? The ACT test is like doing a pure tone audiometry test, but only with some background noise added. It was designed to have a very similar procedure as PTA. Now, I will show you a video where you will see the whole process from start to finish.
The Audible Contrast Threshold Test, also known as ACT, allows you to assess how well someone can hear in background noise. It does this by using a special signal that is non-language specific. ACT makes full use of the pure tone audiogram, making this an above-threshold test. To perform ACT, you will need an audiometer with the ACT license, headphones or insert earphones, a patient response button, and a completed binaural audiogram with thresholds stored for at least the following frequencies: 250 Hz, 500 Hz, 1 kHz, 2 kHz, and 4 kHz. Now we have everything we need. We can go ahead and perform ACT. From the audiogram screen within the Affinity Suite, go to Menu, select Tests, and then click on Act. An instruction box will automatically appear. Instruct your client on what they need to do and make sure they understand to press every time they hear the special signal, which sounds like a siren. Ensure that you have demonstrated the sound examples so that your client knows what to listen for. Once your client is ready, click Proceed to Test and press Start. As soon as you press Start, your client will hear episodes of noise. The test starts at 16 dB NCL. Press only once to deliver the siren at this intensity. If the client hears the siren correctly, a black dot will automatically appear on the trace. You continue performing the test in the same manner as pure tone audiometry. Once a heard response has been stored, go down in intensity by 2 steps and present again. If the client does not hear the siren or does not respond to the sound in the correct time frame, a white dot will appear and you increase in intensity by 1 step. This 2 down, 1 up approach is the same as audiometry, and the test will automatically stop and store a value once it has reached 3 out of 5 correct responses. Once the relevant number of correct responses has been reached to produce an ACT value, a green bar will appear in the middle of the screen. You can now use this to counsel your clients about their ability to hear in noise. Press on the Guidance tab to reveal our recommendations for the different ACT severity levels. Use this for counseling, to adjust hearing aids, to recommend assistive devices, and to discuss rehabilitation and communication strategies. Selected hearing aid brands use the ACT value to automatically optimize their adaptive hearing aid features.
So here's a quick summary of how the ACT test is performed. During the test, pink noise is presented binaurally via headphones as the constant background noise. The sound level of the pink noise is based on the client's hearing loss. A spectrotemporal modulated signal, or STM for short, which has similar characteristics to a speech signal, is then presented. This STM signal sounds like an ambulance or emergency siren, and the client's task for the ACT test is basically to recognize when he hears the siren. And as soon as the client hears a siren-like signal, he presses the response button. After doing the procedure, the final result is an ACT score between -4 and 16, and the higher the value, the more difficult it is to hear speech in noise. This means that the person needs more help in hearing speech in noise, including with their hearing aids. So if the client gets a 0 or a minus score in this test, that can actually be a very good thing. Now we will take a look at ACT inside the ExpressFit Pro software. But, of course, it is also available in the Oasis Next software. As you saw in the video earlier, remember that the ACT test is done with the Affinity Compact Diagnostic Equipment. It's also available in other companies, but I'll discuss that later on. Step 1. You do an audiogram, then you select ACT, and you will then see this instruction box pop out. There's a script that you can tell your client written in the instruction box. So let's say I'm the HCP, so now I will tell the client. Now we will do a speech test, which will be able to determine how well you can hear in noisy situations. The results of this test can then be used to adjust the hearing aids to give you the best performance in noise possible. You can familiarize your client on what to listen out for with the sound samples on the right. And finally, You can then click the button that says Proceed to Test to begin. Once the required number of thresholds has been reached, the test automatically stops and the bar above the graph will turn green and will show the calculated ACT value. The ACT result is measured in dB/NCL, which means normalized contrast level. For this example, the ACT value is 2.5 dB/NCL after doing the test with the client. If you click on Guidance, you will see the ACT guide showing the different values and what they mean. The ACT values are divided into 4 severity categories, similar to what you might find in pure tone audiometry. You have normal from -4 to 4, mild 4 to 7, moderate 7 to 10, severe 10 to 16. So in other words, the higher the ACT score, the more help the client needs to hear speech and noise. Earlier, our ACT value was 2.5 dB/NCL. This falls in the first category, which is normal. That means that the client can most likely discriminate and recognize speech and noise and perform well in a noisy setting. There is also a fitting advice section, which shows how you can approach the hearing aid adjustment. Here on this picture, it says adaptive features set to minimum level and that you should help preserve natural sound in all environments. On the other hand, if your client's score is 10 dB/NCL, it falls under the severe category, suggesting severely poor speech and noise performance. Here, the fitting advice says that adaptive features should be set to the maximum level to help prioritize speech understanding, and that the client should also consider streaming devices and communication training. This is probably the point where you should really consider devices such as the Sound Clip A to help your client hear in longer distances or situations of high noise and reverberation. In ExpressFit Pro, you will find ACT under the Client Data tab. The 2.5 dB/NCL ACT value we had from the Affinity Compact will be stored in NOAA and automatically transferred here in the ExpressFit Pro software. 2.5 dB/NCL is still within the normal range, suggesting that the client has normal speech and noise abilities, and the darker the color gets, the worse the speech and noise ability is. Under the Feature Selection tab, the ACT value will automatically adjust the level of noise management support to optimize speech understanding and noise, and you'll see this later on in the case study. For Oasis Next, the process is similar. Under Client, you will find ACT. You will see a similar graph, and the support and noise features will automatically be adjusted based on the ACT value. The ACT value will influence the prescription of the following features. You have radiant states, radiant noise reduction, radiant engage, speech optimizer and noise minimizer, and of course, our latest Impulse Noise Reduction Pro. One thing which is very important for you to know is that the audiogram and the age of the client, in addition to the ACT value, will also influence these settings. That means that even if the ACT score is the same, but the audiogram or the age is different, then it will not give the exact same changes in these settings. Now let's talk about how ACT can potentially benefit you in your clinical practice. better hearing aid fitting as well as counseling. If you give a more personalized level of noise adjustment right at the start during the first fitting session, there will be less follow-ups and more client satisfaction because there are overall fewer complaints on speech and noise. ACT can also be the basis for choosing the right technology level. So let's say the ACT score is 16. That's the highest and most severe score, and your client wants the cheapest, most basic hearing aid possible. By showing them actual proof that their speech and noise ability is actually really bad, you can upsell and recommend a higher technology level that has better noise management options, which leads to a better ASP or average selling price, and you can also close that sale and sell that hearing aid. ACT goes beyond the audiogram by quantifying the client's ability to hear in noise, and that is a unique selling point because anyone can do a hearing test, but how many can do a speech and noise test in 2 minutes? Because unlike other hearing clinics, we don't only measure how soft you can hear, but actually measure how difficult it is for you to hear in noise. And you can now offer your client the test to do exactly that. So this sets you apart from other competitors and really sets a new standard in your clinic because in the client's eyes, you know what you're doing and you offer a great solution to their problems. Let's now put it all in practice and use a case study to see how ACT can make a difference in your clinic. In this example, I have two clients. Their names is David and Sophia. David and Sophia have the same age, 65 years old, same audiogram, which is a 40 dB flat hearing loss, and fitted with the same hearing aid, a Sonic A1 100. David speaks Japanese, and Sophia speaks Russian. But remember, it doesn't matter because the ACT test is not language specific. So the only difference in this example is the ACT value. David has an ACT value of 14 dB NCL, and Sophia has an ACT value of 4 dB NCL. David's ACT value is 14 dB NCL, which means he has a severe problem with understanding speech and noise. In the ACT value guide, -4 to 4 means that the client has normal speech and noise ability. This means that they will most likely perform really well with hearing aids. And as the ACT value goes higher and higher, 4 to 7 shows mild difficulty with speech and noise, 7 to 10 shows moderate difficulty, and 10 to 16 shows severe difficulty with speech and noise. And the more severe it is, the more the software will adjust the noise settings to the maximum highest level possible. So for Sophia, who is in the normal range, she can still use a more basic hearing aid. And for David, you will need to counsel and tell him that he will most probably have more difficulty in noisy situations, even with hearing aids. This score suggests that David should get a better technology level with more noise management features. A remote microphone or assistive listening device will also benefit him greatly to improve the signal to noise ratio of complex listening environments. And David will also benefit from using strategies in noisy places, like choosing a more cozy, quiet place with carpets, low ceiling, and tablecloths so that it can dampen noise, or calling the restaurant in advance to get a quiet table in a corner. You can also tell David to position himself so that he can clearly see people's facial expressions And all of these are really good strategies to adopt. So someone like David can get the best listening experience and not only depend on the hearing aids to hear optimally. Sophia's ACT value of 4 dB NCL is really good considering her age, with normal speech and noise ability. After ExpressFit Pro reads the results, it automatically adjusts all of the noise parameters under features, as you can see with the target icons. ACT has prescribed these settings for Sophia. For radiant states, it is medium, which is around 80% effect. Radiant noise reduction is also medium. Radiant engage is high. Speech optimizer is medium. Noise minimizer is also medium. And same thing with the impulse noise reduction pro. So since Sophia can separate the sounds and hear speech and noise well enough based on the good ACT score, the software recognizes this and sets most of the features as medium. And you might be asking, why not just choose the highest settings for all clients? The natural speech cues processed by the hearing aids should actually sound as natural as possible, and we lose that natural sound when we artificially try to optimize too much, especially if the client doesn't need it. And since Sophia has a good ACT score, she will only need additional help from the hearing aid's advanced features when the situation actually gets more challenging. Now for David, his ACT value is 14 dB NCL, which means he has very severe difficulty understanding speech and noise. This means that David will benefit greatly from having additional technology to hear better in noise. And this could be recommending a higher hearing aid technology level, using a remote microphone, or something as simple as telling David to mute the microphone while he is watching and streaming sound from the TV adapter or watching a video on his smartphone. ExpressFit Pro takes this ACT value into account and automatically prescribes the noise settings for David. Here, the radiant state, radiant noise reduction, and speech optimizer are now high instead of medium to emphasize and give more help for speech understanding. Since ACT is tested above threshold or above the existing hearing loss, there are instances where the HCP should consider whether this test is actually appropriate for their client. Successfully obtaining an ACT value can be more difficult if your client has a severe to profound hearing loss, hyperacusis or severe tinnitus, since presenting a loud stimulus might actually exacerbate these things. We also don't recommend it if the client has less cognitive capacity to focus during the test, and also if the client is under the age of 18. Now that we know the possibilities with this test, how do you get it? In order to perform the ACT test, you will need to have the relevant licensed software and diagnostic equipment. You will need one of the following products. From Interacoustics, it is available in Affinity Compact software version 2.21 onwards, as shown on the picture at the top. For MedRx, it is available in Avant ARC, Avant A2D Plus, AWRC, or Avant Stealth. And for GSI, it is available in the AudioStar Pro. I put the picture of these equipments at the lower part of the screen. Aside from these specific diagnostic equipments, the good news is that no additional equipment is needed to perform ACT. As long as you have a PC, keyboard, headphones, or insert earphones, a client response button, and the ACT license, you are good to go. If you have any further questions regarding this, please ask your regional sales director for your specific market. It is compatible with Sonic A1 and Sonic Radiant SE hearing aids. For Radiant SE, make sure the firmware is at least 1.1.0. And for all other hearing aids, ACT will not influence or adjust the settings at all. To summarize the presentation, here's a slide showing why clinicians who have tested it so far really like this test. Clinicians like ACT because it works. It is an objective test with years and years of research behind it, and it takes an average of 2 minutes to do, which is so important in a busy clinic. And you do not need to struggle with language challenges, which means this test can be done worldwide in all countries. It is also easy to learn with a very short learning curve and is an easy to perform test like PTA. And I can now tell you that ACT has the potential to change the world of hearing aid fitting. The audiogram tests the loss of audibility, while ACT tests for the real world hearing abilities and noise, and not just when they are inside the soundproof room. Clinicians like ACT because they feel more secure that their client is helped in the best way possible, because you provide a better first fit in terms of adjusting all the noise management settings automatically just by doing this test. And finally, there is now a clear path forward in helping frustrated clients who really struggle hearing in noise. And all of these are the benefits you get with ACT. Although I know that this test is probably not widely available for now, and you don't have this test in your clinic, my hope is that this test will eventually be more commercially available in more and more audiometers and diagnostic equipments, so it can be used all over the world in the next coming years. And I hope that ACT will be considered the next gold standard in the field of audiology, same as pure tone audiometry, tympanometry, acoustic reflex threshold, and that it'll be used in more hospitals, universities, and clinics like yours, especially since you deal with clients day in and day out, and they have to wear the hearing aids and have to deal with noise all the time. So you might not do the test now, but at least you have a good introduction to what this test is and what it can do for you. Here are the resources that are available for ACT. On the left-hand side of the screen, you will see the ACT Quick Guide, showing you how ACT works in Oasis Next. This guide is not available for Express Fit Pro, but the principles are the same. Also, don't forget that a lot of practical information are in the help files that you can access through the software. There is also a 5-minute ACT video explaining what ACT is about. And for those who are very detail-oriented and want to know more about ACT and how it was developed, can read this article by Lee Martin, who is the director of the Interacoustics Academy. So that ends today's presentation on ACT. I wish you a good day and goodbye.